5:30, a new rule in the Compassionate Care Act could help solve one of the program's biggest problems. We've reported for months now that there is a lot more patients than doctors. As News 4's Jen Shantz reports, this is going to change. Jen?
Well, Alina, nurse practitioners will now also be able to certify patients for the program. At the Dent Cannabis Clinic in Amherst, that will more than double the number of medical professionals who can certify, which will hopefully open the doors for more patients to get involved.
Our patients ask us daily, and it's difficult because we just don't have a space for these patients.
The Dent Cannabis Clinic gets up to 70 calls a day from prospective patients. There's only 9 doctors now who can certify, but that's going to change. The DOH recently extended that rule to include nurse practitioners. Director of the clinic, Dr. Laszlo Mechler, is excited to see his staff take a more active role in patient care.
I think now that we can actually see consults and continue with follow-ups, that it will certainly help with his backlog.
He also thinks this will move the state's program forward in a big way.
Presently, there's about 750 physicians in New York State who are registered. Now, we have 19,000 nurse practitioners in New York State, so the numbers will increase dramatically.
There's more Mechler would like to see fixed, though, primarily more support for ongoing research.
One of the issues is among physicians is that this whole medical marijuana issue is driven by patients and politicians for now. It has to be driven by the medical community, and we just don't have the appropriate research to allow us to give results to our patient population.
Theoretically, Mechler could research at the state level, but wouldn't get any support federally. This needs to change, he says, if medical marijuana has a real shot at improving the lives of patients and cutting down on opiate abuse here in Western New York, which it's proven to do nationally. From ALS to epilepsy, medical cannabis is used to treat dozens of disorders. But there's a big one New York State hasn't allowed for yet, and that's chronic pain. It's an indication accepted in almost every other state and would change the game in a big way here in New York. Now, this new rule for NPs doesn't take effect for another 45 days until after a public comment period. They'll have to take a 4-hour-long online course, and then they'll get approved by the state. All patients still pay out of pocket for medical marijuana. Dr. Mechler says the research component is a huge part of getting insurance companies on board. Live in the studio, Jen Shantz, News 4 at 5:30. Nalina?
Jen.